In today's video, we are going to be talking about signs of fibroid. So if you notice any of those signs, please visit your gynecologist or your fertility doctor. If you like what you are seeing in this platform, why not like this video? Why not share? You guys should share the video because a lot of people need this information. Number one is heavy flow or heavy bleeding. Maybe your flow wasn't so heavy like that. All of a sudden, it starts being heavy. You would like to meet a gynecologist. Number two is painful baby dancing. When you are jollificating with your oga, you'll be feeling that place they pain you. Please visit your doctor. It is a sign that something is developing in there. The next one is frequent urination. I know that a lot of things can cause you to urinate, but as a woman, if you notice this and maybe you have checked your sugar level and it's okay, and yet you are experiencing frequent urination, please speak with a gynecologist. The next one is lower back pain. All of a sudden, you start developing back pain. In fact, anything that happens to our system gives us sign, but because sometimes we don't pay attention, we are afraid to go to the hospital, we are afraid to meet doctors. This is why these things sometimes escalate. But if you notice these signs and you speak with a gynecologist or a fertility doctor, they can do something before it gets out of hand. The next one is constipation. That is difficult in passing your stool or whatever you want to go to. You understand, you find it difficult to pass it out. It is also a sign. Another one is pelvic pains. If you are noticing this pelvic pain, please speak with your doctor. The next one is bleeding in between. I hear people often ask this question. They say, my flow just stopped and it started again. Some people say my flow doesn't stop. It continues. This is the sign of fibroid. The next one is infertility. How does it affect you? One, fibroid cannot stop you from getting pregnant, but it may stop you from carrying the pregnancy to the end. Why? Because the place your fertilized zygote is supposed to implant is the place that the fibroid will stay, depending on the size, the position. If it is outside your uterus, it might not affect you. But if it is inside, especially submucosa and intramural fibroid, these are the ones that make a lot of women to experience miscarriage. So it will affect you not to carry your pregnancy to the end. And again, submucosal fibroid, if you do not treat it, might lead to tubal blockage, which will also lead to infertility. But fibroid doesn't stop you from getting pregnant. The next one is long period. It makes your flow to last very long. Another one is difficulty in emptying your bladder. When you go to pee, it will look as if your pee will never stop. So these are the signs that if you notice, you need to alert your doctor. I am not a medical practitioner. I am a researcher. Always follow your doctor's instruction. And if you learn one or two things from this video, do not hesitate to share, like, comment, review, recommend this page, and God will bless you.